Hi, Dr. Kim Lara here from Gonstead Physical Medicine. We wanted to show you what it was like to get a low back adjustment at our clinic. Right here, Dr. Lara is using the nervoscope, which is an instrument that helps us pinpoint the area of nerve impingement, the area that's causing the pain. Next, we do something called motion palpation, where we feel the movement of the joint, left and right of the sacroiliac joint and the lumbar spine, to find out the vertebra that is stuck or not moving correctly. The adjustments are very precise and specific according to the misalignment, and they're very gentle and effective. As you can see, our low back adjustments are very precise, very effective, they do not hurt, and they really help your low back pain.